Hello, consumers. How are you today? Are you feeling depressed at all? Have a headache? Can't focus on your work? Weak stream? Or do you just feel overwhelmed with drug companies interrogating your person through the television this way? Take a look for yourself. You might recognize some of the following ads.
2, 3, 4. Got me a honey, gonna set my soul on fire.
About this new low-dose birth control pill. It's called Yaz. Yeah, it's the only 24-day design pill with a unique hormone.
That's me, Brett Favre. And it's my 9th day with Prilosec OTC.
Talk to your doctor about Zoloft, the #1 prescribed brand of its kind.
Prescription Mirapex may cause you to feel drowsy or fall asleep during normal activities such as driving.
Other risks include impaired judgment or motor skills and
Sexual side effects, diarrhea, nausea,
swelling of your tongue or throat, or shortness of breath.
headache, diarrhea, and abdominal pain.
Blood clots, stroke, and heart attack.
Or stomach and intestine problems, such as bleeding and ulcers, which can occur without warning and may cause death.
Geez, I don't know why the poor guy on the bike got it the worst. Here's Dr. Brian J. Isitz on the scare factor of these advertisements.
If you listen to the end of the television advertisements and listen to all the side effects, you'll never take another medication again in your life. Well, it can cause half the things you currently have. So why would you want to take a medication? So this further confounds the ability for us to effectively care for patients.
However, not all drug companies get away with this. Not even Pfizer's biggest moneymaker, Lipitor. The company recently pulled the following ad under pressure from a congressional committee. Let's try and find out why.
Just because I'm a doctor doesn't mean I don't worry about my cholesterol.
Whoa, the very first thing he says, he's a doctor, right? So you can trust him. But what kind of doctor is he exactly? Here's Dr. Jarvick responding for himself in an interview on ABC.
That you are leaving the impression that you are a physician who can prescribe medicine, who can see patients, when in fact you cannot. Can you prescribe medication to patients?
No, I am a medical scientist, not a practicing physician.
You know, I trusted him because he said he was a doctor and because of his what device he had a role in. I liked that ad. It worked for me. Some of them I don't, you know.
Inventor of the Jarvick artificial heart, Dr. Robert Jarvick. For many people like me, diet and exercise aren't enough. But adding Lipitor significantly lowers bad cholesterol, 39 to 60%.
Now here's a pretty serious claim. It sounds pretty straightforward, but don't take my word for it. Here's Dr. John Hallberg, a primary care physician.
Lowers cholesterol by 39 to 60%. Like, what does that mean? There's no frame of reference. It sounds really great. Is that relative risk reduction or absolute? I mean, we don't know what they're talking about. So it sounds fantastic, but that I've also learned that over the years that you always get these wonderful things from the drug reps showing these dramatic rates of improvement, but from what? And it's just completely out of context.
Now, regardless of what that actual number represents, the one our primary care physician doesn't even know, isn't the ultimate goal preventing a heart attack, not just lowering cholesterol?
I take it because it does more than that.
So it's personal for Dr. Jarvick, but is this truthful? Here's the doctor himself.
Did you take Lipitor before you did the ad? Because you talk about taking it.
No, you know, that's very interesting because my father died of heart disease. I had high cholesterol. I exercised. I tried very hard to control my diet for a year. Numbers didn't change. Nothing moved me to do it. I was fully aware of Lipitor for years. After I started doing the ads, about a month after, I said, you know, what about me? And I saw my doctor, and he prescribed it for me.
Okay, then. Well, back to the ad.
Unlike some cholesterol medicines, Lipitor is FDA approved.
FDA approval makes Lipitor sound pretty legitimate. But what about the approval process? Here's Dr. Hallberg again.
Of course, there's no context to the fact that if they apply to have their drug sort of promoted a certain way, it go through the FDA that way, but why wouldn't all statins have that same benefit? You know, it's only because they sort of couched it a certain way that it gets that label, and that's very misleading for consumers. I think that, you know, providers know that there's probably a class effect as opposed to an individual drug effect.
Lipitor is FDA approved to reduce the risk of heart attack and stroke if you have several common risk factors for heart disease.
But not by much. This ad fails to tell you that in a clinical study, 3% of patients taking a placebo had a heart attack, compared to 2% of patients taking Lipitor. This means 100 people needed to take Lipitor for one person to benefit. That's a lot of Lipitor for a single person.
Lipitor is one of the most researched medicines. You don't have to be a doctor to appreciate that.
But you may have to be a spokesman for the drug to really appreciate it.
How much are you paid?
I'm paid an amount that I think for a celebrity ad would be considered a lot by most people.
You're going to tell
but
Congress
if you're
how much?
Oh, sure. If you're talking about the amount of money that, say, professional athletes make for dealing with these things, I don't think it's comparable to that. I think it's a lower scale than that. But people would think that it's a lot of money.
Lipitor is not for everyone, including people with liver problems and women who are nursing, pregnant, or may become pregnant. You need simple blood tests to check for liver problems. Tell your doctor if you're taking other medications or if you have any muscle pain or weakness. This may be a sign of a rare but serious side effect.
What they don't tell you is muscle pain and weakness is listed as a common, not rare side effect on their website and in the drug's package insert. Is it then both common and serious?
Lipitor is one of many treatment options to consider with your doctor. Lowering cholesterol is important, but could you be doing more with Lipitor? Ask your doctor. Don't wait.
This simple suggestion, ask your doctor, costs people a lot of money. If people go to their physician to ask about Lipitor, Pfizer doesn't pay for the appointment, and Pfizer doesn't pay for the physician's time. Where these costs actually land is on top of the healthcare system.
You know, we did a study here at the university several years ago about that, like how many people came specifically, like made the appointment to talk about an ad that they had seen or heard about, and it was something like 3 or 4% of the visits were for that purpose, which is not insignificant. That's more than I have people that see me for pneumonia, for example. But you know, I don't mind that we talk about it. I'm trying to remember when I last sort of gave in and prescribed something that they had heard about. I mean, it almost never results in that. It usually results in some context and people walking away, I think, maybe knowing a little bit more about a condition, but not needing that particular medication, frankly.
Advertising in healthcare shouldn't be like advertising for automobiles or kitchen appliances. If George Foreman didn't use the Foreman grill, nobody would face any serious side effects from trusting his endorsement. And certainly, Sears or providers of the Foreman grill wouldn't incur extra costs from you asking.
The impact of the brand name medications, and there certainly is a positive side to this, is that you have to conduct the research and development. That has to be done. But does that have to then be put into a television commercial, go directly to the consumer? I think not. And especially in this day and age of access to the internet, to biomedical libraries, if an informed consumer can go use the other resources that are much more trustworthy than a television advertisement. And in my opinion, these television advertisements are further driving up the cost of these medications to an exorbitant amount. And this is one of the major reasons why we have such a high cost of medications in the United States. Think about if we got rid of all the direct-to-consumer advertisements and redirected all these billions of dollars that are spent on this to helping patients use the medications more effectively. Working directly with the pharmacist. If a patient wants more information, all right, then to work with them with through their access to the patient's access to the internet and to the medical resources that are reliable. Think how much farther along we can be in improving the health of Americans. It's mind-boggling, and direct-to-consumer advertising really is holding us back.
There's a reason why this type of advertising is banned in all countries other than the US and New Zealand. And there's a reason why Dr. Jarvick is no longer Lipitor's spokesman. You, the consumer, should be wary of endorsements and easy numbers, and not rely on the latest and greatest, or as we've seen, the trusted name brand.